My name is Dr. Scott Farrell. I am a urogynecologist and professor in the Department of Obstetrics and Gynecology at Dalhousie University in Halifax, Nova Scotia, Canada. I did my training in urogynecology with Dr. Donald Ostergaard and Dr. Alf Bent at the University of California facility in Long Beach, California in 1989 and 90. During this program, we will cover the following areas of knowledge. We will begin by describing how the Uresta pessary is uniquely designed to combine ease of use with a highly effective means to stop urinary stress incontinence in women. We will then go on to review the components of the Uresta fitting kit, and finally, in some detail, describe the process of pessary selection and fitting and the ongoing care of the woman who is using the Uresta pessary. So the Uresta bladder support has a tapered tip, which allows for a gentle dilatation of the vagina. And the vagina itself is about midway up, has an angle, so it angles backwards in a more horizontal orientation when a woman is standing. And what that does is it allows the tip of the Uresta to interact with that more horizontal part of the vagina, which rotates the wider bell shape into position under the urethra. The bell shape was designed with the idea that if it rotated, it would still provide support. There'd never be a time when it would rotate out of a position where it would provide support to the urethra. So that's its main advantage. The intention was to make it as widely available as possible. So we also anticipated that one size does not fit all, and so developed the kit with 3 sizes. Most women would start with the intermediate size, a size 4. If they found that either this was falling down or not stopping the leaking, then it would be recommended that they go to the size 5. If, on the other hand, they found that they had difficulty emptying their bladder, then they would go to the size 3. So that's the approach that we have recommended, and it seems to have worked well for most people. This discussion presumes that a thorough diagnostic process has been followed and a diagnosis of stress urinary incontinence has been made. In order to facilitate a successful Uresta pessary fitting, it is important to do a complete pelvic examination that includes attention to 3 significant features. Firstly, assess the degree of pelvic organ prolapse. The Uresta pessary is ideally suited for women with stress incontinence who have only no pelvic prolapse. Moderate to severe degrees of prolapse will likely displace the Uresta pessary, causing it to shift away from supporting the urethra and possibly causing the pessary to fall out. Secondly, assess the health of the vaginal epithelium. A healthy vaginal epithelium is essential to the successful fitting of any pessary. Women with thin vaginal epithelium are more prone to experience pain with insertion and removal of a pessary, vaginal discharge while using a pessary, and vaginal abrasions that could result in bleeding. Patients with vaginal dryness and/or atrophy should be offered therapy with local hormone treatment to restore vaginal health for at least 2 weeks before pessary fitting. Hormone therapy should be maintained as long as the Uresta pessary is in use. Thirdly, determine the dimensions of the vagina. The vagina must have adequate length and volume in order to properly accommodate the Uresta pessary. These dimensions in conjunction with the diameter of the vaginal introitus, will guide the selection of the Uresta pessary size. Generally speaking, a size 2 Uresta pessary is best suited to postmenopausal women, and it is also most appropriate in young women who are not sexually active. Sizes 3 through 5 were successfully used in 80% of women involved in the clinical trial of the Uresta pessary. One of these 3 sizes will fit the majority of your patients. And finally, a size 6 pessary may be necessary in women with a gaping introitus or with prolapse. Having selected an appropriately sized pessary, be sure to lubricate the tapered portion of the pessary up to the widest dimension of the bell-shaped ridge in order to facilitate pessary insertion. The patient should be instructed not to empty their bladder before the pessary fitting. With the patient in the dorsal lithotomy position, hold the Uresta pessary handle with your dominant hand and insert the index and middle fingers of your non-dominant hand into the vaginal introitus, using them to depress the posterior introitus and slightly separating the labia. Over the top of these fingers, direct the Uresta pessary into the vagina so that the tip and inferior surface of the pessary follow the posterior wall of the vagina. As you continue to advance the Uresta pessary into the vaginal introitus and along the posterior vaginal wall, the tapered design will gradually dilate the vaginal introitus. I always warn the patient at this time that they will feel some pressure at this point in the insertion process. I reassure them that once the pessary passes under the pubic bone and fully into the vagina, the pressure will stop. If the pressure necessary to insert the Uresta pessary is too great, or if the vaginal introitus appears maximally stretched, it is likely that the size is too large. The insertion process should be stopped and the next smaller pessary should be tried. Once the Uresta bladder support has passed under the symphysis pubis, it will fall naturally into place under the urethra. It can be gently advanced with a finger on the base of the handle if the handle appears to project into the introitus, but this advancement should not exceed 1 to 2 centimeters. When the Uresta bladder support is properly placed, the handle will usually be visible just below and behind the urethral meatus if the labia are separated. If you are unable to see the handle of the pessary, it may have been inserted too far. Simply grasp the handle and pull it down into place. Have the patient cough while in the supine position. If they leak, remove the pessary and try the next larger size. Have the patient stand and cough. If the pessary remains in place and the patient does not experience any bladder leaking, have them go to the bathroom and empty their bladder. A woman who is using a properly fitted Uresta pessary should be able to comfortably go about their daily activities. They should be dry, they should not be aware of the pessary in the vagina, and they should be able to void both their bladder and their bowel without any interference from the pessary. There are certain indications that the Uresta pessary size may need to be adjusted. It may be necessary to switch to a larger sized Uresta pessary if the pessary falls down in the vagina so that the woman becomes aware of it, or if it falls out with activities. And also if the woman experiences ongoing stress incontinence. It may be necessary to switch to a smaller sized Uresta pessary if the woman is uncomfortably aware of the pessary in the vagina, or if she is unable to empty her bladder. To remove the Uresta pessary, grasp the handle and pull the pessary down toward the introitus. As the wide bell-shaped portion reaches the introitus, rotate the handle upward toward the pubic symphysis to rotate the pessary out of the vagina comfortably. The Uresta pessary may be used in a number of ways. For women who only experience bothersome incontinence with specific activities, for example, vigorous aerobic exercise, the Uresta pessary may be inserted before these activities and removed immediately after their completion. On the other hand, for women who experience urinary incontinence while performing routine daily activities throughout the day, the Uresta pessary may be inserted in the morning and removed in the evening at bedtime. Because the risk of malodorous vaginal discharge and vaginal abrasions increases with the duration a pessary stays in the vagina, optimal care guidelines call for daily overnight removal and washing of the Uresta pessary. Some patients find that it is easiest to insert and remove the Uresta pessary while in the upright position with one foot elevated and braced on a secure surface. Others prefer to perform these maneuvers in the supine position. The patient should reach into the vagina with their thumb and index finger, grasp the handle of the pessary, and pull it down and out of the vagina. To assist the removal, they can bear down as though having a bowel movement to bring the pessary down to the introitus before removing it from the vagina. The Uresta pessary was designed to optimize the opportunity for patient self-care. This means that follow-up care can be individualized to suit the clinical preferences of the healthcare provider and the comfort level of the patient.